Okay, I said I wasn't going to do this. Anyone that knows me knows how excruciating it is for me to reveal personal information about myself. But I feel like it's important to share this information. I want to do my small part to contribute to the collective knowledge of society. And like many people who have traumatic things happen to them, they like to use that as an opportunity to advocate for something, and I want to do the same. So basically, this past March, I was diagnosed with ALS. It's also known as Lou Gehrig's disease. If you're not familiar with that, it's also the ice bucket challenge, but it's a fatal neurological condition that affects the motor neurons in your muscles. Your brain's not able to communicate to the muscles, and the muscles slowly atrophy and shrink and die, and you have progressive muscular weakness, which eventually results in your death. And depending on the circumstances, it's the progression is different in every individual. Sometimes it's very slow, sometimes it's very aggressive, and in my case, it's pretty aggressive. They've given me about 2 years to live, so it's pretty serious. And there's no cure whatsoever. There is a drug that's been out since the 90s. It's a glutamate blocker. It maybe buys you like a month or two. And there's actually a drug that just came out. It was just FDA approved this past August. It's very preliminary, but it did show some success in slowing the progression in some of the test patients in Japan. And again, it just slows the progression, and that success rate was around 30%. Of course, but that drug is it's brand new. It's very expensive. It's about $140,000 a year. It's intravenous. Again, the long short of it is I'm dead. So, not to be morbid or anything like that, but that's the reason why facing that, what it is I want to advocate for is, death with dignity. Now, before I get into that, I want everybody to understand that I want to live. I enjoy life. I'm not suicidal or anything like that. In fact, I feel like I have a very positive attitude about this diagnosis. I honestly feel lucky in some ways. Very few people are fortunate enough to not only know the timing of their death with any kind of certainty, but also the manner. And it gives you time to prepare and think and get your affairs in order. And so, and that I feel very lucky. In fact, the only thing that's really that I'm really struggling with is the fact that really before I got this diagnosis, I was pretty much exhausted in a lot of ways, mentally, physically, emotionally, but most importantly, financially. And due to those reasons, I'm not able to make the best use of my time, and that's a struggle. I have a hard time with that. But as far as the overall situation, again, I feel pretty fortunate. In the fact that I have an opportunity here. With that being said, I can accept a lot. If this, I've already accepted a lot. I mean, since this diagnosis, I was just diagnosed in March. Basically, I was working full time till July, and since then I've pretty much lost all the use in my left leg. The muscles are really atrophied in my thigh, in my foot, and on my right hand. You can't see it here, but I can basically just move my index finger. And it's already at the point now where I really need a walker. I have to use a cane. I have to use a brace on my leg. And there's atrophy happening all over. Basically under here, I look like the sister from Pet Sematary. If you don't know what that is, Google it. It's pretty bad, but if that was all I was facing, or even if in a few years I would be confined to a wheelchair, or just lose most of my mobility and I couldn't enjoy much but the simple things like just enjoying a sunset or watching TV or whatever, I would learn to accept that. That's how bad I want to live. But that's not really the nature of this condition. The nature of this condition is going to be continued muscular weakness until eventually I won't be able to walk or use my hands, or even it'll go into my face and my throat. I won't be able to talk like I'm talking now. I'll have to be on a feeding tube and a respirator, and eventually the muscle weakness goes into your chest and you pretty much die of respiratory failure, which is probably akin to like drowning, I'm assuming, which is not, just sounds horrible. And you have to remember, while all this is going on, my mind will be functioning perfectly. I'll know exactly what's happening, and I'll just basically have paralysis over my entire body. I won't even be able to lift my head off the pillow. So that's what I'm facing. And we're not talking about 10 years from now. We're talking, already I'm at this point now, and it's been a few months since I had the diagnosis. Another 6 months, 6 months after that, this is happening. So that's why I'm really thinking about death with dignity. Now, before what is death with dignity? Actually, death with dignity is basically, it allows a medical professional to prescribe you what's usually a massive dose of barbiturate, which is like a sleeping pill. And it, basically you would take the medication, and within 10 or 15 minutes you fall asleep. And sometime after that, you would, pass on. And again, there are some issues with this law. First of all, there's only a few states that allow it. And even within those states, one, you have to be a resident, and two, you have to be within 6 months of your death before you can even get the prescription. So like in my case, 6 months before I'm, about to die, I won't even be able to probably communicate or even swallow the medication. It'll just be, it'll be bad. And not only that, the idea, I can't think of a more beautiful place to spend my final days. The idea of just uprooting everything and exhausting what finite resources I have, moving to, Oregon or Washington State or California, it's just not realistic. And, Michigan is my home. This is where I live. Ironically enough, I live in Oakland County, which is the home of Dr. Kevorkian. And, this is not available to me here. And, even if I decided that I wanted to move back to my home state of Florida, back to Pace where I grew up, that's not an option that's available to me there either. And, again, I know that's, it's difficult to think about. And even if I had the option right now, it's very easy for me to sit here and comport myself in this way and, talk about this in a very matter-of-fact way, because it's not a decision I have to make right now. It's still a little farther out. It's not reality at the moment. But, when that time comes, I may not actually be able to even go through with it. I might not be able to do it. But I know if I at least had that prescription in my hand, I would feel more comfortable, and I would have security, and it would give me for me, it would give me the will to fight a little longer and try and try to survive, just knowing that I had that option. And for people that maybe are feeling a little, uncomfortable with the issue, or not really sure how to feel, I know a lot of people probably totally understand where I'm coming from. But for those people, all I can say is, our technology is advancing rapidly, and what we may be capable of doing in the not so distant future there's no telling. But right now, as of today, if you're watching this, and you live long enough, you're going to be in my position at some point. And, you may not, while it may seem like a ridiculous choice right now, you don't want to wait till you're in my position to be wishing that you had that option. So, it's something to think about. And I hope people, consider it and try to do what they can to make this option available to everyone. Again, that's what's so great about it. Even if you have the option, you don't have to do that. And it's just, it's more or less, about security. And really, to me, it's not an option. I have two choices, basically. And it's going to get to a certain point where I'm either going to, die a very horrible way, or be able to go out in peace. And that's what it really comes down to. So, I hate that it has to be like negative, and it's not it's a Debbie Downer type post, but hopefully people think about it, and we'll go from there.